As we all know, the malnutrition in IBD is very multifactorial. Many patients have a loss of appetite. This, again, can cause fear of foods. This loss of appetite could just be the fact of some of their symptoms, the nausea, the abdominal pain that they're having with a flare. Again, these patients are poorly absorbing and digesting their foods. So again, many of these patients, again, are having this vicious cycle of malnutrition. And then just your regular needs increase when you're having a flare. So again, inflammation is going to pull a lot of your protein and those things that you should be eating, and if you're not eating enough of that, it is a definite vicious cycle. So again, when in a flare, I do recommend really trying to reduce stress. Patients do note very often that stress is a big factor in their flares. Again, when someone's in a flare, obviously reducing the fiber, so especially those raw fruits and vegetables. We'll talk a little bit more about that. Increasing that easily digested protein, so things that are already basically broken down. So not eating a very stringy piece of meat, eating something that's going to be soft, whether it's shredded meat, eggs, yogurt, nut butters, rather than having a handful of nuts that you might be able to have if you're in remission. And then again, watching those high-fat foods, watching those caffeine and the carbonated drinks. So again, fiber. Patients are often avoiding all fiber, which again is not necessarily something that everyone needs to do. We'll talk a little bit about manipulating that fiber so that you could eat some of the colors of the rainbow and that you can have them, whether they're broken down into a smoothie, whether you have them roasted, steamed. But when you look at the two different types of fiber, the doctors often want you to really, truly reduce that insoluble fiber. So that's that roughage. That's the stringy ends of asparagus, the apple skins, the potato skins, celery. So if you think about celery and rhubarb, they're very stringy. So those are the things that will never break down in your intestines. The soluble fiber is something that can help to form a gel type of matrix in your GI tract. And it could be quite helpful. So if you think about oats in water, if you put oats in water or Metamucil in water, it turns into a goobery type of substance. And so this can help to slow that transit time, reduce that gastric emptying that might be very fast with a flare. Again, things that have soluble fiber will be your bananas, your applesauce, your oatmeal. And so regardless of consuming fiber, patients should definitely gradually increase it, because if you go from having 0 grams of fiber one day to the next day having 30, doesn't matter who you are, you're going to have some different GI discomfort. So again, when it comes to incorporating fiber into the diet, whether somebody is going to cook vegetables or into a pasta sauce, blending them up. You can make a stir fry with very soft vegetables, roasting vegetables, blending soup. So again, blending some of those good soluble fibers, whether you make a butternut squash soup, a pumpkin soup, a tomato soup, a potato soup, doing things like that that might be a little bit more appetizing, and they could be a way that you can get in some of that healthy fiber. Again, when it comes to bananas, soft melons, and fruits that don't have the skin, those are usually well tolerated in most patients. We'll talk about some things with exceptions. Again, beans and lentils. Most patients can't consume too many beans and lentils, but if you are in remission, if you're having things like a little bit of hummus or a little bit of vegetarian type of refried beans so it's not too greasy, if you have a small amount, again, not having 1.5 cups or 2 cups of beans, but having a small amount, and if it's cooked very softly, it may be well tolerated. Again, when it comes to nuts, a lot of patients are completely avoiding nuts when they were diagnosed 25 years ago. And so nuts, again, if they're a very hard nut, like an almond that's hard as a rock, that's going to not likely be very well tolerated. But if you have something now you can find nut flours, nut butters. I'm sure you've seen various nut butters in many stores, whether it's peanut butter, almond butter, cashew butter, sunflower seed butter. There are a variety of different nuts, and in each nut, they're going to have different types of nutrients and different types of healthy fats. So again, those can be incorporated for most patients. When it comes to nutrient deficiencies, many are patients that have decreased absorption in their upper GI tract, in their small intestine, may have issues with anemia. Again, if someone is bleeding. So we do check iron on our patients. Again, we'll talk about some of the symptoms in a second. Vitamin B12, as I pointed out earlier, if someone has an ileal resection, their B12 may just in fact be very low. And so we like to check that and make sure that that's in a good level. Vitamin D, again, if we think about where we're at in the country, most people's vitamin D is quite low. So this is something I like to look at in patients, especially if they've had surgery. And again, just baseline, because as we know, we don't get much sun in the winter. And zinc, again, if someone has fistulizing disease, if they have skin issues, if they're never healing, again, I like to look at the zinc level because this can help to heal that tissue in your gut as well as throughout your body. So again, some of the signs of deficiencies are very overlapping. Again, if you think about zinc, patients might have spots on their nails, delayed wound healing, as I said, rashes. Again, with the selenium and the iron, they might have different weakness, paleness. Fatigue is with most of these minerals and vitamins as well. So again, when it comes to fluid recommendations, it depends on how much you weigh. So I like to recommend approximately, and this is through the Academy of Nutrition and Dietetics as well, a half an ounce per pound of what you weigh. So again, if you weigh 120 pounds, that would be 60 ounces of water. If you think about if you're consuming 5 Diet Cokes a day or having 6 cups of coffee, they don't necessarily fully hydrate you. Again, there's no big science on it yet to say, oh, maybe a couple ounces of each of those fluids would be somewhat hydrating, but for many of our patients, they cause increased cramping, increased bloating, and again, if you don't have much of an appetite, that won't help